Hello, my name is Crystal Vincent, and I am a DMP nursing student at East Carolina University. And today I come before you to describe or to give you information on HIE. HIE stands for Health Information Exchange. I would like to provide you with several definitions of HIE. According to Dr. Kevin Johnson, HIE is the mobilization of healthcare information electronically across organizations within a region, community, or hospital system. In 2011, Kaufman and Brown defined HIE as the electronic sharing of health information between two distinct organizations. In 2013, Health Resource and Service Administration defined HIE as the electronic movement of health related information among organizations according to nationally recognized standards. And finally, in 2013, Healthcare Information and Management Systems Society defined HIE as the technology that facilitates the exchange of patient specific electronic health information. So let's describe HIE. HIE is a secure and electronic network that gives authorized healthcare providers the capability to access and share health related information across a statewide information pathway. HIE exists to improve healthcare quality, to heighten patient safety, improve patient outcomes, and decrease overall health care costs by permitting health information to be available securely whenever doctors, nurses, and patients need it. Let's discuss some federal legislation and recommendations related to HIE. The American Recovery and Reinvestment Act of 2009 authorized the Center for Medicare and Medicaid Services, CMS, to provide incentive payment to eligible professionals and hospitals who implemented, upgraded, or demonstrated meaningful use of certified electronic health records. These incentive programs will not always be available, and financial penalties are scheduled to take effect in 2015 for Medicare and Medicaid providers who do not translate to EHR systems. Let's talk about some federal legislations related to HIE. The HITECH Act of 2009 provided the Department of Health and Human Services with the authority to establish programs to improve health care quality, safety, and efficiency through promoting health IT, which includes electronic health records, privacy, and secure electronic health exchange. Section 618 of the Food and Drug Administration Safety and Innovation Act of 2012 was developed a report that contains a proposed strategy and recommendations on an appropriate risk-based regulation framework for health IT that includes medical mobile applications that promotes innovations, protects patient safety, and avoids regulatory duplication. The HIPAA Act of 1996 was established. The HIPAA Privacy Rule describes what information is protected and how that protected information can be used and disclosed. The HIPAA Security Rule describes who is covered by the HIPAA privacy protection and what safeguards must be in place to ensure appropriate protection of electronic protected health information. The Affordable Care Act of 2010 established comprehensive care insurance reform that aimed to increase access to healthcare improvement, quality, and lower healthcare costs and provide new customer protection. The Privacy Act of 1974 established a code for fair information practices that govern the collection, maintenance, use, and dissemination of information about individuals that is maintained in a system of records by federal agents. Let's talk about some state legislation and recommendations related to HIE. Many states have enacted their own laws to govern and manage the privacy and security of protected health information. In North Carolina, the North Carolina Health Information Exchange Authority was created by the North Carolina General Assembly to oversee and administer the state-designed HIE. This can be found in the North Carolina General Statute 90-414.7. The North Carolina General Statute 90-914.4 is a law that requires that all healthcare providers who receive state funds for the provision of healthcare services to connect to North Carolina Health Connects by a certain date in 2018 and in 2019 in order to continue to receive payment for services provided. The type of information that you can receive from North Carolina Healthcare Connects is information on inpatient admissions, inpatient discharge, emergency admission information, final lab results, allergies, immunizations, medications, problem lists, and procedures. Lastly, I would like to discuss some barriers identified for federal and state legislation. Some of the barriers that I researched was the lack of funding or running out of funds, especially during the planning stages. There will be long-term financial commitment, data ownership. Will the data from the HIE belong to the government? Will it belong to providers? Or will it belong to patients? Patients' involvement. Patients may or may not care about HIE systems. Another barrier is the standardization of HIE across all states. The movement of information between providers as well as states and federal agencies may create barriers. The inconsistent adoption of electronic health records in a care continuum. This also relates to the lack of incentive for non-primary care providers to invest in HIE. Health data securities that deals with variation in state and federal privacy laws may become a barrier. The health information technology safety and utilization. This will require an increase need for stakeholders to come together and share best practices. Empowering patients to be active participants, stakeholders with HIE process to build trust and confidence within the systems. And lastly, a barrier that I identified was having a statewide EHR vendor that will connect all systems at the state level. Thank you.